Hi, I'm Jackie Bedard, founder of Carolina Family Estate Planning. And in this video, I'm going to share some tips about choosing the healthcare agent for your healthcare power of attorney. But first, let's talk about what this role entails, because I find often when I first bring it up with clients, they go immediately to the extreme and they're thinking about that, pull the plug type of scenario. And while that is one responsibility that this agent may fill, there's a lot more involved to serving as healthcare agent. Modern medicine has made dramatic improvements over the past few decades. We're living longer than ever. But unfortunately, the trade-off with that is that we have a much higher likelihood of being impaired later in life, whether due to physical impairment or cognitive impairment. As a result, our healthcare agents are often serving in this role for months or sometimes years, and they may be doing everything from going to doctor's appointments with us to making caregiving decisions, or even making the judgment call that it's no longer safe for you to live in your own home any longer, and it might be time to seek out a senior community. So based on all of that, you want to choose somebody that you feel like will be a good advocate for you and make sure that your wishes are followed, especially in today's world of modern medicine. Sometimes things can be rushed or disjointed. One doctor might not communicate well with another doctor, or they might miss something in the file. So we find that it's really important that your healthcare agent be keeping close tabs on your healthcare needs, on your prescriptions, and really advocating for your needs. I know my own family ran into this with my grandfather, where sometimes we would have doctors recommending medication that conflicted with another medication he was already on from a different doctor. So you really want to make sure that this is going to be somebody that's going to be willing to ask questions and make sure that you're getting quality care. And when you think about honoring your wishes, you really need to have a clear picture on what that means. For example, if you're an individual who says, I don't want my life extended by artificial means, such as life support, then you want to make sure that you're picking an agent that will honor those wishes. So if that's opposed to their religious beliefs, they may not be a good fit for this role because they may struggle to honor your wishes. On the flip side, you may have religious preferences that are really important to you. And if that's the case, then you want to choose an agent that understands those wishes and will be willing and able to honor them. Now, you may be wondering whether it's important that your healthcare agent be local. And I would say out of all of the roles, this is the role where it can be more helpful to have a local agent serving. That being said, in today's world of modern communication, it's less of an issue than it used to be in the past. More and more medical providers are accustomed to having family members participate by phone conference or video conference. And they can also do things like hire a local healthcare advocate to arrange some of the caregiving services or transportation to medical appointments. So while it's nice to have a local agent that might be able to go to doctor's appointments and manage some of these things for you, at the end of the day, I always suggest you stick to the person that you really feel like is going to be the best advocate for you, even if they're not local. Now, if you're thinking about potentially naming co-agents to make healthcare decisions, that is something we discourage. We recommend naming one healthcare agent to serve at a time, and it's for a few different reasons. First, if you talk to any medical providers, they'll tell you that this is their preference, especially in an emergency situation. If you think about, we want your doctors worried about your medical care, not worried about having to relay information to more than one person and maybe have questions about whether both parties need to agree or can just one person make that decision. So it can really harm the medical decision-making process if we have to check in with more than one person. And in fact, that's what happened in that infamous Terry Schiavo case. There was a dispute about whether her husband or her parents were the ones authorized to make the final decision about ending life support. She was on life support for years while they fought in the court system. It went all the way to the Supreme Court. So that's one of the reasons we really discourage co-agents is we don't want to end up in a situation where they don't agree about your medical care and now we're stuck. So if you are thinking about co-agents, we'd strongly recommend that you reconsider and stick to one agent at a time. If you do name co-agents, then you want to make sure your document's clear about, do they have to act together or can they act individually? And what do we do if they don't agree on something? So those were some quick tips about choosing your healthcare agent for your healthcare power of attorney. If you need more guidance or someone to talk it through with, that's okay. You may want to consider working with our office at Carolina Family Estate Planning. So give our office a call. We'd be happy to take you through a free needs assessment and talk to you more about working with our team.